So basically, tonight I will be talking about stress and adrenal health. If you have any questions, you can put it in the chat box and I will try to address it. Or if I don't see it for some reason, I'll just keep going and look at that towards the end. So to get started, these are some things I'm going to talk about tonight. So what is stress? We hear about it all the time. We feel it all the time. What are the adrenal glands? What happens with acute stress to our bodies and what happens to our bodies with chronic stress. There's a big difference between the two, and this is important because chronic stress can actually harm us. And then how can we manage this stress and how can we repair any damage that's resulted from it? So I sometimes feel like this. You don't need to have small children to feel like you're overworked and have too many things to do and not enough time. So I think this is pretty pervasive in our society. So I like to go back to the basics, and so I typically just go back to the dictionary to look up definitions. So according to the Merriam-Webster dictionary, stress can be a physical, chemical, or an emotional factor that causes bodily or mental tension. And as this lady feels in this cartoon, we definitely feel sometimes too. This cartoon is actually from the book Adrenal Fatigue by James Wilson. I highly recommend it. It explains adrenal dysfunction very clearly. So what are the sources of our stress? Well, they can be life stress, and so the worst is the death of a loved one. It can also be stress from a divorce. Although it's happy stress, even stress from marriage can take a toll. There's stress from job loss and financial problems. At work, we can have stress from working long hours, from having a heavy workload, for not enjoying our job, for feeling like we have a lack of control in what we do, and for uncertainty about where we stand within our job. And then there are also environmental stressors. So these can include toxins, medication, junk food, and poor living and working conditions. And sometimes we're not even aware of them. Internal stresses are things like fears, perceptions. How you perceive stress affects how your body reacts to it, attitudes towards stress, and your expectations. So if you're somebody that expects everything to be perfect all the time, you're also going to be somebody who's often disappointed and often experiences stress when things don't go according to plan. And so what does stress have to do with the adrenal glands is a very good question. And what are those darn adrenal glands anyway? Well, the adrenal glands are two glands located above the kidneys, and they're important to stress because they are the ones responsible for producing and excreting our stress hormones. In addition to this very important job, they also produce aldosterone, which is needed for salt and water balance, as well as produce some of our sex steroids. So in women, the hormones DHEA and testosterone are only produced in the adrenal glands, and after menopause, estrogen and progesterone are only produced in the adrenal glands. Conversely, for men, DHEA, estrogen, and progesterone are only produced in the adrenals. Here's a cross-section of an adrenal gland. In the middle is the adrenal medulla, and this is where epinephrine and norepinephrine are produced, and these are important for the stress response as well. And then there's an outer cortex with 3 layers. So the first layer is the zona reticularis, and this is where androgens like estrogens and testosterone are produced. The middle layer is the zona fasciculata. This is where cortisol and cortisone are produced. And then the outer layer is where the mineral corticoids are produced. So this is aldosterone and corticosterone. So for a little tiny gland, it does a lot of things. So just to understand the stress response, I'm just going to briefly go over what happens to our body during an acutely, so sudden, brief, stressful situation. So there are 2 main things. Number 1, the autonomic nervous system activates the sympathetic nervous system to release epinephrine and norepinephrine from the adrenal medulla. And so this is your fight or flight response. The second thing that happens is a hormone axis called the HPA axis is activated, and this releases cortisol from the adrenal cortex. This is a diagram of some physiological changes that can happen during the sympathetic nervous system activation. So basically, the pupils will dilate. This allows more light in, allows you to see farther. There's an increase in heart rate and heart contractility. So basically, the heart beats faster and stronger. And this is so it can pump blood to the body more efficiently. There's also dilation of blood vessels to the muscles, and this is so it can deliver more oxygen and nutrients in case you really do have to fight or flight. And then there are some pulmonary changes, like your breath gets quicker, it gets deeper, and there's dilation of the bronchioles, which are the tubes to your lungs. And this is all to deliver more oxygen so you can perform better. And then for the HPA axis, what happens is the hypothalamus, which is an area of your brain that's responsible for communicating between the central nervous system, which is your brain and spinal cord, and your endocrine system, which is your hormone system. Well, the hypothalamus releases a cortisol-releasing hormone, and that stimulates the pituitary to release another messenger, which then tells the adrenal gland to release cortisol. And in this diagram, it shows cortisol going to the immune system. And although cortisol does have an effect on the immune system, during an acutely stressful situation, cortisol is very important for managing energy demands. And so one of the primary functions of cortisol is to increase energy availability to meet the increased demands during stress. And then it also helps to restore the body's balance. So how does it do this? Well, one way that cortisol can meet the higher energy demands of the body is to increase the production of glucose by the liver. But then if too much glucose is produced, it can actually increase the liver's ability to store glucose. So it helps keep a balance between the two. If necessary, it can break down protein into amino acids and convert these into glucose for energy. And it can also break down fat to increase fuel for the body as well. Cortisol, as I mentioned, is important for the immune system. So the immune system gets activated when you're under stress, but not every threat requires a full-blown counterattack. So what cortisol does is moderate the immune system so it doesn't overreact. It can also control inflammation by decreasing histamine, and then, as I mentioned briefly, it's also important for sodium, potassium, and water balance. Cortisol is also really important to the memory. So there's an area in the brain called the hippocampus, which is responsible for long-term memory, and this has many cortisol receptors. So what happens during stress is that cortisol binds to these receptors in the brain. And the thought is this is so the brain can remember and hopefully later avoid harmful stimuli in the future. So cortisol is very helpful in short bursts, but cortisol with chronic stress is not so good. So chronic secretion of cortisol is harmful to our bodies because it causes elevation in our blood sugar, which can eventually lead to diabetes and weight gain. It actually leads to fat storage, which again causes weight gain and eventually diabetes. It suppresses the immune system so much that people often end up getting frequent infections. So somebody who usually feels great and is not very sick may start to get frequent sinus infections or recurrent bouts of bronchitis for no unknown reason. And then cortisol, when it's chronically released, no longer inactivates histamine, and this can lead to other inflammatory disorders like rheumatoid arthritis or skin problems like eczema or psoriasis. And then also concerning is the fact that over time, too much cortisol binding in the hippocampus causes the hippocampus to shrink, and that can lead to memory problems. As if that wasn't enough, cortisol can inhibit other hormones, causing a variety of symptoms such as fatigue, muscle breakdown, anxiety, low blood pressure, and sleep disorders. So what are some of the hormones that chronic cortisol affects? Well, first of all, it can lower melatonin, and melatonin is your sleep hormone. So if you don't have enough melatonin, you don't have restful sleep. Then, of course, you wake up tired the next day, and then what do most people do? They drink a cup of coffee or grab some caffeine to help pump them up for the day. But again, that might actually end up wiring them and inhibiting their sleep the following night, and people tend to end up in a vicious cycle where they can't stay awake during the day, so they need caffeine, but then they can't sleep at night from the effects of that. Cortisol can also lower thyroid hormone because it decreases thyroid-stimulated hormone, and this can lead to hypothyroidism. And then it also decreases important sex hormones like DHEA and progesterone. So DHEA has a lot of functions in the body. It can help lower cholesterol. It can help prevent blood clots. It can prevent osteoporosis. It promotes weight loss, or I should say, it promotes fat loss and increases lean body mass. And it can also improve your brain function. Overall, DHEA gives people a sense of well-being. And then progesterone is important for men as well as women, but it can also help prevent bone loss. It can help decrease inflammation. It helps decrease mood swings, anxiety, and it can also help with memory. And then very important for women is it can help protect the uterus and the breast from cancer by balancing estrogen. So this is kind of a busy slide. These are the adrenal gland hormones, and I just wanted to point out a couple things. So on the top left is cholesterol. And so people think of cholesterol as a bad thing, but it's actually what the other hormones are made from. So if you're somebody with high cholesterol on cholesterol medicine, you don't want your cholesterol to drop too low because you won't have enough to make some of these other hormones. So cholesterol can then be converted to pregnenolone, and this is the slowest step or the rate limiting step. So pregnenolone is called the mother hormone of all these other hormones. Pregnenolone can then be converted to progesterone, or pregnenolone can be hydroxylated to 17-hydroxypregnenolone, and then it can be converted down this middle pathway to cortisol, or it can be further metabolized to the right to DHEA. So you can see if you have a high demand for cortisol and all of your chemical reactions are driving towards cortisol, it may steal from some of the other hormones because you only have so much substrate. So that's kind of how they're all related. So what happens if you have a lot of stress over time and you're chronically stressed? Well, eventually you may develop what is called adrenal gland dysfunction. Another word for this is adrenal fatigue, and the book Adrenal Fatigue by James Wilson is excellent. However, adrenal fatigue isn't necessarily a medical term per se. Other terms for adrenal gland dysfunction are hypoadrenalism or adrenal insufficiency. And how does this happen? Well, we talked a little bit about it, but basically the more stress you have, the greater the intensity of the stress, the longer the stress lasts, the higher your cumulative load, and the more likely you are to develop some kind of adrenal dysfunction. So adrenal dysfunction may become apparent after a series of stressful events, and the last stressful event that happens seems to be the trigger for the symptoms. So people can say, I was doing just fine. I just saw somebody like that recently. I was doing just fine. I didn't have any problems. Now all of a sudden I got breast cancer. But if you actually take a careful history, there might be just a history of stress, a history of overworking, a history of not sleeping well. And then the last stressful event, the breast cancer, really just was too much to bear, and that's what triggered all of the symptoms. There's also cases where somebody doesn't have a lot of acute stressful events, but just chronic stress over time, and they end up driving themselves to exhaustion by overworking themselves, not sleeping enough, not taking enough time out to enjoy life, and they just gradually develop adrenal dysfunction as well. So there are 3 different stages. So first, stage 1 is the alarm stage, and this is the first indication that your ability to cope with stress is decreased. Sometimes weight loss can actually occur initially, and then mild infections or injury can develop. And then stage 2 is a very common stage because people can remain in this stage for years. And this is where your body tries to adapt or compensate for all of the additional stress. And one way it does it is by putting the sympathetic nervous system into overdrive. So you end up releasing a lot of epinephrine and norepinephrine. And so You feel go, go, go all the time. You feel very wired, and you actually feel pretty good. So somebody in this resistance phase may be anxious a lot, may have a lot of energy. They may go from working a 10-hour day to wanting to go work out because they have extra energy to burn, and then they maybe have a difficulty sleeping at night. And during this phase, your cortisol can be high, but eventually towards the end of this phase, your DHEA, that nice hormone that makes you feel good and does a lot of healthy things for your body, that starts to decrease. And then when it gets really bad, people enter stage 3, which is the burnout stage. And during this phase, your immune system's very compromised. Infections become much more common. At this phase, you basically bottom out, so your cortisol is low as well as your DHEA. And then you start to get more and more symptoms like periods of low blood sugar, periods of low blood pressure, especially when you're getting up from a sitting to a standing position. You can get very dizzy because your blood pressure drops. People get a lot of fatigue, anxiety, your libido drops. People often complain of muscle weakness and can be depressed for a number of reasons. So some of the signs and symptoms, well, number one is fatigue, but the fatigue is a little bit different than other types of fatigue. For instance, when somebody is tired because their thyroid's underactive, they may be tired all the time. Whereas if somebody has adrenal problems, they have a pattern to their fatigue. So a lot of times they just have difficulty getting out of bed in the morning. So anything before 10 a.m. is very difficult for them. Then they might start to feel better after they eat something for a couple hours, but then they'll have an afternoon low around 3, and then may start to feel better after 6. If they stay up late, they can definitely get a second wind after 10 p.m. Another common symptom is salt cravings. People often also complain of brain fog. So not overt memory loss, but just I'm not as sharp as I used to be. People can develop hypoglycemia or hyperglycemia. So even though they may start to develop prediabetes or diabetes, they will have periods where their blood sugar drops really quickly. For women, they can get worsening PMS or menopausal symptoms. A common complaint is having decreased exercise tolerance and feeling exhausted after exercise. So basically, moderate exercise is supposed to invigorate you. But if you're feeling burnt out after you're exercising, that could be a signal that you have an adrenal problem. People often also complain of decreased performance and muscle weakness. People often get lightheaded, and this can be a combination of the low blood pressure and the low blood sugar. There's also water retention because water balance is off, and so people might get swelling in their legs or swelling in their fingers so their rings don't fit anymore. And then, as I mentioned, decreased libido is common, so are multiple allergies. And the list goes on and on. This is from a journal, a neuroscience journal from 2006. It's a article by an author named McEwen. I thought this was interesting because it shows a normal response to stress and then some scenarios where the response to stress is maladaptive. So in this top graph, on the x-axis is time and the y-axis is physiologic response. And so here you see a normal physiologic response to stress and then a period of recovery. But unfortunately, when people have a lot of stress in their life, they may have repeated hits of stress. And so in this top left, you can see repeated hits of stress where there's a physiologic response and a recovery, and then over and over again. But unfortunately, what happens is if this goes on long enough, you can have lack of adaptation, and that's the graph in the top right, where you respond to the stress and recover, but then the next response isn't as great. You still recover, but each response is progressively less robust, and so you're no longer adapting to your stress, and this is where you can develop medical issues and symptoms. And then in the bottom left is an example of somebody that's just under chronic stress and has no break. And so here you see the physiologic stress response, but then it just stays high up here. And it's prolonged because the stress doesn't abate. And so this isn't just a problem because of the things I mentioned, the problems that happen when you have persistent cortisol, but also think about that epinephrine and norepinephrine. With that also staying high all the time, you're at risk for heart disease and strokes. So there are a lot of reasons why chronic stress is bad. And then the bottom right graph is a graph of somebody who has had chronic stress for a long time and their body is just pooped out. They can no longer mount a normal stress response. So you get a little bit of something and then it just peters out. This is from a patient. It's a salivary cortisol test. And so typically conventional doctors will check a morning cortisol and a morning DHEA on blood. You can also check cortisol metabolites in the urine, so you can do a 24-hour urine for cortisol. And if the excretion is low, it means you're not producing enough cortisol. But really helpful and well supported in the literature is salivary cortisol because it gives you a lot of extra information, so you can do this in addition. And so basically you check your cortisol during 4 points during the day. It's usually highest in the morning. In this patient, she's a perimenopausal woman with a high-powered job and 3 children. She's very anxious. She has a hard time losing weight. And boom, first thing in the morning, her cortisol is off the chart. So her cortisol is 1.75. It really should be, right in the 0.75 to 0.8 area. So she's probably in the resistance phase of adrenal dysfunction. And then it remains high for the rest of the day, but not as crucially high. Then down below, you see there's also a DHEA that has been checked, and her DHEA is still in the normal range. So again, she's still probably stage 2 in the resistance phase, but her DHEA to cortisol ratio is rather low. And this is important because DHEA is a very anabolic steroid, so it helps build tissue, it helps build muscle, where cortisol is a catabolic steroid and it breaks down tissue. So the ratio of DHEA is important, and you do want to balance. If the cortisol is too high, you're going to be breaking things down. So even though her cortisol is high, even though her DHEA is normal, her DHEA to cortisol ratio is low because her cortisol is too high. So she needs some time and attention, and she needs to change her lifestyle, or she's going to end up in the burnout phase pretty soon. And then this next patient is further along. So if you look at her curve, again, it's supposed to be highest in the morning. It's not that great in the morning. Her morning cortisol is 0.49. And like I said, the sweet spot would be around 0.75 or 0.8 on this. And then it's just kind of flat throughout the day. If you further look at her DHEA, her morning DHEA is very low. So it's only 113. It's almost in the red zone. So she definitely could use some DHEA supplementation. And like the other patient, her DHEA to cortisol ratio is on the lower side. So if she's not careful, she is going to end up in stage 3 pretty quickly. Stage 3 isn't the end of the world. It's, you're in bad shape when you get there, but the whole point of this talk is there are some things you can do to make it better. So there are things you can do to prevent it, but if you do get to that point or you're already at that point, there are things you can do to heal the adrenals and heal your body. So how do we restore our balance? Stress isn't going away, but how we manage it, we can change. So the most important thing is probably sleep. Chronic sleep deprivation increases mortality from all causes. So it's so important to get sleep. So 7 to 8 hours of consistent sleep helps the body repair itself. It's best to try to go to bed at a regular time. By 9 or 9:30 is optimal. If you have trouble winding down at night, try to limit your light exposure after dusk because too much artificial light will limit your melatonin production. And then you can do things like practice meditation, do deep breathing exercises, or take a warm bath before bed to help prepare you for sleep. If all else fails, you can take melatonin. Melatonin may be particularly helpful for somebody with a really high evening cortisol because it can help lower this and balance it. So melatonin or calming herbs can help prepare somebody for bed. And some people say, I have no problem falling asleep. I go right to sleep, but I wake up 4 hours later. So for those people, melatonin may be helpful as well. Calming herbs include things like passion flower, lemon balm, and valerian. Chinese skullcap is another one, and sometimes they can all be combined in one product so you don't have to take multiple pills. Just a note about melatonin, you should start with a low dose, so 1 milligram, 3 milligrams, 5 milligrams max. If you take too much melatonin for too long, you might feel depressed because it competes with serotonin, and a low serotonin can make you depressed. So melatonin shouldn't be used every night for years. It should be used intermittently. Sometimes when women are perimenopausal, what I'll do is put them on progesterone, which is calming and helps them sleep the second half of their cycle, and melatonin the first half. So they're on it for a couple weeks, and then they get a couple week break before they go back on it. Another important thing for restoring balance is exercise. So if you're somebody who doesn't exercise, moderate exercise is recommended. And the Department of Health and Human Services recommends 150 minutes a week, and this can be divided any way. So it can be 30 minutes 5 days a week, or you can do 50 minutes 3 days a week. But moderate cardiovascular exercise is recommended, and it also helps balance your stress and your cortisol. Strength training is also beneficial as well, so it doesn't have to be anything fancy. You don't have to take any expensive classes. You can just use some free weights or do body weight exercises. Body weight exercises include things like push-ups, sit-ups, squats, and pull-ups. A lot of women don't have a lot of upper body strength to do an unassisted pull-up, but they do have machines if you belong to a gym where you can do assisted pull-ups, or if you have a bar, you can use bands to help support your weight as well. Livestrong.com, which is an app where you can log your food, has new workouts that are free, so that's something to look into. And I just found a website called Grekkor, GREKKOR.com, and they have a ton of fitness classes. So they do yoga, Pilates, strength training, and interval training, and a variety of durations as well. So if you don't have time for a long workout, you can just look up a 10-minute core workout and do it right there. So I do those sometimes. I find it very convenient if you don't have time to go to a fitness studio or go off to the gym. You can just do it really quickly at home. And the nice thing about that is it's variety as well, because I find I get bored if I do the same thing over and over again. So although moderate exercise is recommended if you have a cortisol imbalance, vigorous exercise is not. So vigorous exercise does include things like high intensity interval training or CrossFit. Basically, too much exercise can be just as harmful to your adrenals as no exercise. And overtraining will also lower your cortisol, your DHEA, and your testosterone. It also results in frequent illnesses and chronic injuries. And similar to cortisol imbalances, people who overtrain can actually gain weight. So nutrition is the third piece of the puzzle. The worst things for your adrenal gland are caffeine and alcohol. Both artificially release cortisol, but then you tend to bottom out, leading to increased stress and anxiety. They also tend to reduce sleep quality and worsen insomnia. So definitely, if you have an adrenal issue, you need to avoid these as much as possible, and I would say completely. Other things to avoid are processed foods, sugar, hydrogenated oils, red meat, because red meat has a lot of arachidonic acid, which is inflammatory, gluten, and dairy. So it sounds boring, but you will feel better. And then an important piece of the puzzle is also being able to adjust your work-life balance. So it's hard to sometimes juggle work with your family life, with personal time, and with ensuring you get 7 to 8 hours of sleep. Plus, you really should fit in time for laughter and enjoyment, right? What is the point of life? All work and no play is no fun. So there are some charts that you can use to help you evaluate how you're spending your time. They're called radar charts, and I'll show you an example on the next slide. But I would suggest doing a couple versions of these charts. So one version would be, how are you spending your time? What's taking up the most of your time? And then the second version would be, how do you want to spend your time, or how should you be spending your time? And this is an example of a radar pie worksheet. I got this from a recovery program. But basically, you can put a different aspect on your life on each slice of the pie, and then just rate how much time is it taking up, how much energy is it taking up, and how much would you like it to, and how much should you be putting towards that one specific part of your life. So in summary, to restore balance, if you have any adrenal issues, it's important to sleep at least 7 to 8 hours a night. Exercise moderately, but avoid competitive sports and vigorous exercise. So moderate exercise is exercise enough to raise your heart rate, and you can speak when you're exercising moderately, but you can't sing. If you can't speak when you're exercising, it means you're probably more in the vigorous exercise range. And then in terms of nutrition, it's good to avoid caffeine, alcohol, hydrogenated oils, and refined carbohydrates, which include sugar. It's good to eat organic, clean, anti-inflammatory foods. Also, it's important to eat regular meals. For people with adrenal dysfunction, it's good to eat before 10 and then eat again at 12. And chew your food well. So many people don't do this. If you want an example of how not to eat your food, go to the airport and look at the people who are eating there. I swear some people only chew their food 5 times before they swallow, but really you want to chew your food about 30 times. Take smaller bites, don't gulp in too much air, and eat slowly. And this will help you digest your food better and absorb your nutrients better. So chewing your food well sounds crazy, and my kids roll their eyes when I tell them that all the time, but it actually is a really important, easy way to improve your health. Also, meditating or practicing relaxation techniques for at least 15 to 20 minutes a day is important. So I mentioned, you can take a bath and all this stuff. You can also do yoga or do Tai Chi. If you have the money, go get a massage, go get a facial, pamper yourself a little bit. It's very relaxing. And then you want to evaluate and adjust your work-life balance. One person with a lot of adrenal problems was telling me that she has all these kids, but she has to do all this travel, and she has a big trip coming up to New York to work at the Clinton Global Initiative. And she said, I can't miss it. I'm in charge of the VIP seating. But honestly, you can miss it, because if you're not there, somebody else will be there to do the VIP seating. And if you're not in the classroom supporting your children 1 day a week, another mother can do that. Or if you're not there to work overtime, maybe somebody else can. So it feels like, oh, I can't, people often say, I can't change this. I have to do this. But the reality is you really don't. It really is up to you. And there's always going to be somebody else who can do it. And you don't have to feel guilty because you can't. And so the last thing is just find time to play. So that's enough for most people, but people with more severe adrenal problems may need additional vitamin C and B complex vitamins. And I wouldn't recommend just going over the counter and buying a bunch of B vitamins and vitamin C. There are a lot of reputable nutraceutical companies that make complexes of B and C just for people with adrenal problems. Adaptogenic herbs can also help. So these are things like licorice, which is very effective for adrenal problems. Ginseng, so either Panax ginseng or Siberian ginseng is helpful. Rhodiola is another herb, as well as Rolora. Rolora is a combination of magnolia bark and philodendron. And then, these all also sometimes come in combinations of a few at a time. So I know there's one by Metagenics that has licorice and ashwagandha. That's one I forgot to mention. There's another one that has cordyceps mushrooms, rhodiola, and Panax ginseng. So it all kind of depends on what your symptoms are. And these can be taken to help kind of calm your mind. If your cortisol is too high, it'll bring it low. And if your cortisol is too low, it'll bring it high. Someone with a low DHEA can take DHEA supplementation. And again, for women, you don't want to go with a dose that's too high. I know when I go to Lazy Acres, I often see DHEA 50 milligrams, and that is a crazy amount for a woman. Women should really start at 5 or 10. And too much DHEA may cause hair growth or acne in women. So that's something to look out for. Or sometimes even at low doses, women will sometimes convert that DHEA to testosterone and get hair growth and acne anyway. So for those people, keto DHEA is sometimes helpful because it doesn't get converted to testosterone. But in most people, I would suggest starting with DHEA and only switching if there's a problem, because you can measure the DHEA in the saliva or blood, but keto DHEA is hard to measure in blood, so you don't know how well it's working. And then for women who are perimenopausal, or actually even menopausal, you want to replete progesterone if it's low. If you're menopausal, you want to replete estrogen as well if you don't have contraindications to it. So progesterone at night for people can really help with sleep. It gets converted and binds to GABA receptors, and that's very relaxing. So progesterone at night is very helpful, and it can decrease things like night sweats and frequent awakening as well. Melatonin can also be used if someone's having sleep issues, and in some extreme cases, adrenal gland extracts are used for a period of 6 months to give people the building blocks they need to help repair their adrenal glands. But again, that's in severe cases and not for everybody. So if you guys have any questions, let me know. You can ask them now here, or, I don't have a moderator that's helping me with that. The other thing you can do is just email me at drmartha@thrivehealthmd.com if you have any questions about anything I said, or if I said something wrong, let me know. I know I presented a lot of information, but basically cortisol and epinephrine are needed for us to cope with acute stress, but too much stress can actually cause a lot of harmful changes within our bodies. And so there are ways that you can try to rebalance this. So sleep, appropriate exercise, good nutrition, relaxation, finding time for yourself, adjusting your work-life balance. Those are all important things. Some people may need additional help if they're not getting better, if they're really sick. And then, if you have any further questions about any of the supplements, you can just let me know and I can give you some suggestions, but I wouldn't recommend just going out and buying things. I like to test everything. So if you think you have a cortisol imbalance, I would recommend checking to see if you do for sure. The other thing is I'll make this available on our website, which is thrivehealthmd.com. So there is a password for the webinars, but if you want to share it, the password is capital T, HRIVE, Thrive 515. So it's Thrive 515. And so we'll probably have it up in a day or two if you think you know anybody who could benefit from listening to the webinar and they have the time. So thank you all for coming. I really appreciate it. And let me know if you have any suggestions for future webinars. I'm really open to doing whatever people want to hear about. And I hope you all